So we just finished our case today, and I thought I would show you a few of the retractors that we use in breast surgery. So I'm going to start with things we use close to the skin and then show you things we use when we're deeper at the very end. So this first retractor is called a double tooth skin hook. So we use this just to retract the skin right after we've made the incision, and these little sharp instruments work really nicely to not damage the skin edge or the blood vessels under the skin. This next one is called a sen. It has one end with sharp teeth, and then it has one end that is flat that you can push into the tissue and pull away to make a bigger space. This is another one. I don't use this one as much. The mastectomy surgeons use this one more. We've always called it a cat's paw or a cat's claw at places I've worked, but I'm sure it has a real name. I just don't know what it is. Scrub text in the comments. You can let me know. This is also used to retract mastectomy flaps or usually skin edges. And now moving up, we're getting into things for deeper retraction. This is called an Army-Navy. There's a big side and a small side, and you can flip it around depending on what you want. Next, even deeper, will be a goulet. So goulets we use a lot in breast surgery. We also use them for the node dissections for my breast cancer surgeries. And then one of the deeper retractors we use in breast surgery, like if I'm taking a capsule out of a patient for a capsulectomy, this is called a Deaver, and they come in different sizes. The blue coating that you see on some of these retractors are meant for preventing arcing from the bovie and burning the skin. Because if you have a metal instrument touching the skin and the bovie touches it or it arcs to it, you can actually burn the skin. So that's why these have blue coating, and we have these redone all the time so that they don't get worn and start to separate from the instrument. So that's just a quick little review of the retractors we use in breast surgery. Retractors and instruments in surgery have different names in different regions and in different countries. So if you call them something different, let me know. I'm interested to hear what you guys call them in your operating room. And let me know if there's any other instruments you'd like to see.